Hello, welcome to episode 3 of They Said There Was a Dystopian Novel. And we were on chapter 8. See, he turned from the evening news a week or so later, when she'd returned to normal and was doing her sewing under one of her lamps at the workbench beside the front window. I told you they'd have the vaccine soon. The big news was everywhere. Even Deirdre had heard about it from other teachers. He couldn't wait for the rollout that had pharma companies everywhere devoting themselves to getting stocks of it, so people all over the world could be saved from the horrible disease and not have to live in fear of suddenly dropping dead, leaving devastated families behind, waiting to find out if they were to suffer the same fate and drop in their tracks as well. All the hospitals were full to bursting, and all resources had to be focused on getting the vaccine to people quickly so they could live. There were parts of speeches shown with shots of world leaders on their podiums saying nearly exactly the same things, although he couldn't read some of the captions under their foreign languages terribly well, or understand their accents when they spoke in English. She didn't seem as overjoyed as he expected her to be. I wonder when the doctor will have it, he prompted, feeling eager to share his joy and get her to start planning the appointment side of it now. No doubt there would be a rush to get it, and it was important they were first in the queue, as he was a government official whose work was vital to the smooth running of the country and indispensable. There might be a system with all the important people going first to get their injections and the less important people coming next. He would make sure to tell Deirdre to remind the doctor that her husband was in a very vital job to the economy and always needed to be at work. Then maybe even the children would be vaccinated after the old and delicate people. He couldn't understand how the children weren't considered one of the riskiest sectors of society, since they were always running about with their friends outside the schools, as well as on their little breaks around the schoolyards, although they didn't sweat all over things as much, potentially spreading germs as they used to, since a lot of school playground and public playgrounds had less things you could break your neck on and sue the government for, since insurance was very expensive these days. Even personal insurance costs were prohibitive, he mused, and they weren't covered for everything. Really only health insurance for travelling abroad on his wife's basic plan. They needed to be first in line. Deirdre, can you ring the doctor tomorrow to see if we can book an appointment now to get our injections? I know it's early, but there will be a rush, and I know how the supply chain works. There might be production delays with the vaccines, or not enough to go around. I'm very busy tomorrow, Robert. Can you not ring them yourself? They both saw the same doctor at a big clinic that had just opened up to replace the rather run-down and decidedly underheated doctor's surgery that had occupied the same building near their nearest supermarket in the shopping complex on the ground floor. He hadn't been there himself yet, as his health was robust, but Deirdre had told him about all the new doctors there, the automatic-style glass doors at the entrance, operated by intercom and push buttons that you had to press before the reception desk let you in, when she returned from one of her visits to do with trying to have babies. It would be a nice day out, seeing what improvements they made. The other doctor was a bit of an elderly bumbler, he'd always thought, prescribing headache tablets and rest for everything, as far as he was aware, from any visits he's had, for flus or trapped nerves in his neck, which he decided wrongly were most likely just heavy colds or a bad posture contributing to headaches. He'd probably been retired. The new clinic was far more likely to be up to speed on the latest science and would, as a bigger medical practice, probably get more batches of the vaccine in than the old place might have received. Her lack of consideration was irritating. "I have a very busy day tomorrow too, Dee." The pet name usually came out when she was being awkward, and it was helpful to keep a good rapport at home, even though someone wasn't a co-worker, but part of a family unit, to keep that unit running smoothly. "It's signing day tomorrow." The office was terribly busy on signature day because although they had eliminated the need for the unwashed to physically sign their names to forms, they still came up on the front desk computer screens when they signed their names with the special stylus on the little panel to the left of the window, on front of the glass window. They were so stupid that there were often delays, as someone had to tell them to do it several times because they hadn't pressed the little accept button under it, just above the groove where you were to replace your pen for the next customer. Or they didn't press hard enough on the screen with the pen and just stood there stupidly looking at it until they were reminded that it didn't register it. Try again. He was glad he didn't have to deal with them, as it must take patience. He'd seen one of them once completely unable to hold a pen at the right angle to get it to write, somehow getting its attached cable tangled around his hand. He'd met the employee's eye as he'd passed back into the office from the meeting that day with the over-manager his section had attended, and he thought the employee was about to roll her eyes up to heaven until she recovered her composure in time. On signature days, the digital signing forms transferred electronically to the back office's care to be completed fully, and paper duplicates produced to go in the client's files. These had to be in order and fully up to date in case the client needed to be interviewed about work prospects or transferred onto a public work scheme if they had not submitted the correct paperwork with completed forms filled in, proving they had applied to at least 7 places for jobs in the previous month. They were expected to seek and take up all and any work available and to inform the human welfare offices immediately should any such opportunity be offered, so that their employment assistance allowance could be terminated concurrently. All this had to be gotten through, as well as the extra work of forms on signing day once a week before they could trot off again to pick up their handout from the bank like a daylight robber, without the gun but with the attitude. Depressing bunch they were, he thought, and the office sometimes smelled vaguely of them, at least before the cleaning and disinfecting regime had been implemented. Now he didn't even have to see their faces if the car alarm went off on breezy days and he had to walk past them on their benches. They were much improved by the masks, and the office now had a reassuring smell of bleach on it to replace the vague, unpleasant odour of many humans confined in a small place. The new clinic would be clean and organised too. He was almost looking forward to the inconvenience of probably having to take time off from work an hour or so to get his injection. But there were forms for that to fill in, and he knew the procedure was that you had to get your form in by 2 days before such appointments, even if he wasn't sure yet when Deirdre would be able to get them in. As it turned out, it was weeks before the first batches were available, and there was huge excitement about these. It was all over the news. Understandably, everyone would want to get their batches first, and the smallest countries might not get a look in until later, But those who were on very good terms and had a good working relationship with central governments in the main economic areas where the biggest factories were located would have the advantage, and deals could be swung by astute politicians, he felt sure, to get enough doses to have an early response to the health crisis the new virus was creating. Finally, the new batches arrived, and there were news stories on both evening broadcasts, which showed the planes landing that were bringing them in. Deirdre had been reminded to ring the clinic again to book an early appointment for them, as the first injections were due to start happening the following Monday, with people working all through the weekend to rush them to surgeries, clinics, and hospitals where they were needed. There was more protective equipment arriving too, generously sourced and supplied by international governments working in tandem, and these would be desperately needed by the brave staff working at hospitals day and night to save the victims' lives. The equipment might help contain the outbreaks of contagions that were now showing up in the national and international figures based in hospitals and old people's institutional care settings. They were run off their feet too, with people dying. The elderly and people with other diseases were dying in huge numbers from what he could gather, between all the statistics shown, with demographic details like average age of deaths over the months since it was first discovered, and location demographics showing different outbreak regions. The vaccine injection would stop all that death, but in the meantime, we all had to protect the old and vulnerable, as the information leaflets that came through the door with the junk mail stated. He usually read the mail in the evenings, sorting into piles, one with the junk for Deirdre to filter further, and decide if he'd missed anything important, and the other with bills and invoices for monies owed and receipts for things paid. Sometimes Deirdre's mail was in there, and it went in the junk pile, since she would be sorting it herself anyway. The bills, etc., were dealt with immediately in his desk's inbox in the spare room, or left for keeping household accounts up to date by totting up and filing away expenses at the end of the month, before they went in their neat brown card folders to be stored away on the top shelf opposite the spare camp bed that was never used, with rubber bands around which divided the months. He usually had plenty of folders to spare, since he took the liberty of bringing extra ones home to put his work files in. They'd never be missed in small numbers, since he was in charge of ordering stationery. He had headed paper there as well, although he wasn't in charge of writing letters to clients. That was more of a manager's role. But he might utilise the extra supplies such as this later or sooner if his over-manager was struck down, or even one of the main managers, who would then be replaced by a sub-manager. Pity they would be first in line for the vaccine as well, in a way, but it couldn't be helped, and at least they wouldn't be spreaders. He stared at the small camp bed, and it occurred to him, could you get it that way? From sleeping with someone infected. If you could get it off surfaces, and maybe even through the wet bits in your eyes, maybe you could get it from other parts as well, if you were, well, rubbing up against them. If it gets inside your body and can come out your nose and mouth, maybe. He hadn't seen or heard anything about that, but it might be wise, at least until they both had got their injections, to refrain from that. If she asked when they got into bed, he could always say he'd a bit of a headache, or needed to be fresh for a big day ahead to get off the hook, as they say. That wouldn't offend her. Make sure she's not breathing in my face all night either, after being around filthy kids all day. Easy measures, which result in a nice warm back for the night to boot. Chapter 9. The over 40s were to go first, with no exceptions. He wasn't far off the age bracket they specified on the news as being the first cohort, as they put it, of patients to be seen for injections. They hadn't the resources to do everyone at once, of course. He understood that. Did they not see, though, that it was the vital workers that needed to go first, and that 40 to 50 age bracket didn't cover younger and super active potential spreaders like himself, who were in contact with a lot of people during the course of their week, while manager types probably had their own offices away from constant contact in work and so on. Even the younger menial types you saw delivering supplies and fixing computers and that type of thing were easily replaced if they got sick and died. But people like him were not easy to replace. He had specialist training and an important role and needed his injection fast. The statistics suggested that they were the most susceptible to the illness, as the most active potential spreaders, regularly crossing international lines, so they would get their shots first. It wasn't broken down by male and female, he noticed. Females, being weaker, might catch it easier and spread it. There weren't enough injections to do everyone at once, so it was proposed that the next rounds of injections, which could commence as soon as supply deals had been secured from countries promising to meet production goals, when they arrived, would be for any hospital staff missed in the first cohort, and care home and home aid workers in contact with old people, who were the most fragile members of society that we all had a care of duty towards, to protect them, were next on the list. Then the younger cohorts would receive their injections. It was very unfair. He realized it might be weeks, or maybe even a month or so, before he would get his seen. And there had been no warning of this from the doctor when Deirdre tried to make the appointment. In fact, the receptionist that answered said that they wouldn't be sure being able to book regular appointments for other patients given the crisis, and need to keep the clinic from becoming a source of an outbreak. So if there was nothing else we could do for you today. And then she hung up. Sorry, Robert, she said, when they were seated at the table in the kitchen. I know you must be a bit disappointed, but we'll be seen soon in one of the next groups. And as soon as we all get the injection, the whole horrible thing will go away. I haven't been able to do anything fun in ages, even meeting pals for coffee and a bit of cake, and buy a few bits and bobs I need down the town. It's very grim looking in town with everything closed, and they can't even come here. I miss the laughs we took for granted and all the choir nights and the historical group, even, although some of them are not the best fun at that, and the slideshows they sometimes put on are just dismal. They're so amateur. There's no sign of life anywhere now. They both pushed around the food on their plates, which was a pork chop, peas, and mashed potato that he usually ate no bother. Well, you've got your television programme tonight that you follow up. He knew this because it was some crime thing that didn't finish before the second evening news, that he always had to remind her to switch the channel over from when the news was about to be on. And was the reply. I have to start finding something I can do at home, I suppose. There's even some talk that the schools might close down temporarily while everyone's waiting to get their shots. The kids would enjoy being home with their parents for a while, I imagine, but some of the parents have jobs like us that they have to go out to. The news had announced earlier that non-essential workers should stay home if they could, to work from their computers if they had that opportunity to do so. A lot of people worked in offices, perhaps not in as important a capacity as himself, but might be able to work from home, thereby limiting their chances of an outbreak starting in a busy office environment. He therefore wasn't very surprised about the schools, but hadn't heard anything like this on the news. He looked at her, waiting for more information. There was a circular went out to the schools to say it might happen. I don't know if it will, though. He wasn't sure if this was good or bad, because you might have children wandering around in groups then, unsupervised. Traffic in their area was off the main road, and they sometimes were seen on bicycles or those little go-kart pretend cars off to the playground or to kick a ball around in a field at the end of the road. Any sort of unsupervised mingling was risky in terms of outbreaks, although Deirdre told him they had erected a sign outside the playground saying children must be supervised by adults to keep them apart in groups of not more than 3 at a time. Everyone had to keep their distance, even when seated on the benches to talk while the children played. Sometimes, from the living room, you could hear them shouting as they ran about after the school week was over. Deirdre noticed these things more than him, but of course she was a woman, so probably noticed children more, and was having to notice them all day, so they were on her radar, so to speak. A few days later, the news was confirmed, and suddenly all the schools closed. Deirdre was still in bed when he was heading off to work, and it was annoying being expected to get your own breakfast when you didn't know where things were. After asking where the coffee pot was, and the coffee for that matter, and getting a vague "in the press" answer and no further answer, as she'd seemed to have fallen asleep again, he gave up the idea of wasting time over breakfast and decided to get something on the way. She'd soon adapt to the new morning routine, and it wasn't for long after all. Perhaps a cinnamon bun with some decent coffee to be eaten in the car park on arrival before the side door opened and work began. Now, where to get coffee? He hadn't done that before, except at the petrol station. Well, that was as good an idea as any, since they did excellent cakes, and it was a nicer breakfast than Deirdre's egg and toast for a change, they say, is as good as the rest, isn't it? He thought of Deirdre with some resentment, warming her behind in bed still, while he was out earning a crust. The takeaway breakfast was not going to be a regular thing when you had food at home and someone to prepare it. The coffee was wildly expensive too for what you got. He was surprised to see not only a queue forming in the petrol station for cars filling up before work, office workers perhaps, but another queue forming for the mini market you paid for your petrol in, having forgotten that there might be a queue given the fact that many restaurants were closed. Their wives must all be lounging in bed as well, leaving them to fend for themselves. The thought of missing his extra minutes listening to the news before going into the office crossed his mind. It might take him 10 minutes just queuing up before he even got into the shop, and what was the queue like inside? He sat in his car weighing up his options. There were no biscuits in the break room, and he couldn't take a break until the appointed time anyway. What to do? He joined the end of the queue, realizing he would be ravenous by break time, and didn't want the desk opposite him giving him looks if his stomach grumbled. He was hungry already, but annoyed about the queuing and the unexpected hitches in his plans. It had started to drizzle lightly now, and although there was a golf umbrella in the back of the car somewhere, that someone had left behind in the Human Welfare Office, that he'd borrowed one day when it was lashing rain to get to his car, he didn't want to leave the queue to get it, as he would have to join the end of it again. He arrived home that night in a bad mood. His whole day had been spoiled by it getting off to a bad start. He'd had to take his lunch break in his car just to catch up on vital news updates, and although Deirdre had packed sandwiches for him, missing his usual breakfast was an interruption that affected his workflow, with a sense of annoyance hanging around that couldn't be dispelled, even by seeing the inbox pile go down lower as the day progressed. An overheard snippet when he returned that confirmed that the overmanager would be out on Thursday morning to get his injection when many other staff would have to wait didn't help his mood. Deirdre asked about the breakfast and said she'd make it the next morning, which was something. At least she realised they were a team and had to work together to support the earner, since she was temporarily off work if still contributing something to the bills with her wages still coming in. They should put her doing voluntary work, seeing that children observed local playground rules or something, he thought, since she had nothing else to do work-wise. Her free wages seemed unfair, useful as they were to the running of the household. Perhaps she might do more stringent cleaning at home now, since she'd no excuse to be slovenly about it. He raised the matter as soon as she started to talk about some projects she was putting together for the kids, for when the school opened its doors again, which would probably be in a few weeks' time. I noticed your things all over the table in the living room. He didn't normally use the table himself, having the small office desk in the spare room, but it was still part of his environment, and it bothered him to see the mess spread out. But not to worry, you'll have more time to clean up before I come home with your whole day free. You can get a nice little cleaning routine going, can't you? He smiled jollily, giving her the hint that she didn't get to just lie about all day and do nothing. Robert, it's just a few little projects. You never use that table anyway. The stupid woman didn't get his meaning at all. You know, you're still going to the supermarket where all the spreaders are and are still unvaccinated, so you could be trailing in all sorts if you don't up your hygiene practices. He used the term for disinfecting things that he'd heard on the radio, as there had been a feature on it that very day, and he liked the reassuring sound of the routine it suggested. There's nothing wrong with my hygiene standards, Robbie. He hated this name, and she knew it. The bitch. Are you calling me dirty? You don't seem to be taking this virus seriously enough, no, he admitted. And one has to be constantly vigilant. I heard on the radio that there's a way of swabbing your vegetables when you get home from the supermarket after you unload them. Then you have to swab the counter you put them on, then yourself as well, of course, before you touch anything else. Oh, for God's sake, I only get the groceries once a week, unless we run out of milk or bread, or I fancy a chocolate bar to go with the cuppa, Rob. They aren't even that paranoid about it round the shop. The shop on the corner. He hadn't thought of that. She'd be running back and forth there, now she was free all day, for stupid things, without taking proper precautions. He was sure she'd be running into all sorts of types there, since a few of the unemployed were in their neighbourhood, and they were filthy in their habits. He knew from looking at them in the morning queue outside the office and the main waiting area, sitting scratching themselves while waiting to remember their own names to sign the signature forms. Then the children, all loose now, going in and out, buying sweets. Deirdre, you must not get in the habit of buying things locally. It's far more expensive, probably, and will run up bills unnecessarily. You should confine yourself to the supermarket. A thought occurred to him. We might need to stock up a bit on essentials. Chapter 10. Robert decided it was best to leave the car to be washed until after they returned from the supermarket on Saturday, since Deirdre insisted she couldn't manage 2 weeks' shopping herself. He knew they had large trolleys outside the supermarket, having seen people trundling them in the big car park towards their cars sometimes on passing on his way home from work. Rather than create an argument about it, he volunteered to give her a lift and help her pack the groceries in his own car, which was a lot more roomy than hers. It might be interesting to go in with her and see the traffic flow system in place that she'd described to him for himself. He liked seeing all the imaginative new solutions to humans standing too close together that were being implemented. As they arrived, about 11 a.m. by his watch, he could see the queue already, before he was parked up straight in the box marked out. often a tricky manoeuvre to perform, necessitating several attempts to go forward, then back, then forward, correcting the angle as you parked. Sometimes you had to open the door to see how well you'd done it before turning off the engine. Deirdre, who really should have pointed it out before he'd parked, insisted that he was making it a bit more difficult to load the groceries, parking at the end of the car park furthest away from the supermarket's sliding doors with in and out marked on them. "You'll have a trolley, won't you?" he said, pointing to the row of large and smaller trolleys for shopping in a covered shelter a few hundred metres away from where they'd parked, feeling irritated already, when in fact he was helping her. They joined the queue after some discussion about where to get the trolley, Deirdre reminding him that there were more nearer the entrance, and he noticed a warden was moving up and down the line there, and there was even a little tape with movable bollards, like the ones at the airport check-in desks for the cheaper flights, or the bank before they'd put in the self-service machines, so he felt sure that they would not be inconvenienced too long by having to stand. The customers were following the rules too, he noted, as they joined the end of the line, standing some distance apart. This made the queue seem longer than it was, possibly, with it stretching halfway around the warehouse-style building. Those who were a family group of 3 or less were standing together, the others sensibly keeping their distance from one another. They'd both put on their blue plastic masks, with surgical delicacy, adjusting here and there before stepping out of the car, with him politely proffering the hand disinfectant to Deirdre before they opened the packets and put them on. He could see customers moving about inside and staff at lanes punctuated by tills moving the customers through quickly enough. Staff were fully compliant with good hygiene, wearing not only the rubberized gloves and surgeons' masks, but also had an extra layer of protection around their checkout zone, with large plastic barricades between them and the customers to prevent infection. There were no problems moving along quickly with the warden there, moving them along to the indoor every time someone left the store through the outdoor beside it, then stepping out in front of the next person with his hands raised in a stop signal. There was a slight bottleneck at the little station inside that had been set up to provide a spray sanitizing disinfectant for trolleys, presumably the parts you rested your hands on while pushing the trolley along, and there was another gel-type dispenser that was clearly marked hands, for those who had been foolish enough to not bring enough gloves out for visiting different shops, he supposed, or perhaps even, it struck him, might be trying to sneak in without gloves, which admittedly were pretty hot worn inside. Once they'd gotten their trolleys sterilised and moved up the aisles, Deirdre started picking things off the shelves in twos as instructed to throw in the trolley, and he had a chance to see what signage and instructions for customers were in place inside. He'd noted the clear signage about wearing a mask and gloves correctly outside, and had high hopes that the managers would have everything inside as well under control. There was a loudspeaker with health information about observing the distance rules, which played on a loop, and other customers appeared to be adhering to the rules nicely, standing waiting for their turn at the right distance as another customer leaned towards shelves to get whatever packet they required. Although there were minor bottlenecks at points, and sometimes you were set off course slightly as another customer approached you from the opposite direction because one of you had to move out of the way, resulting in a little dance before you decided which of you was to move away to allow room. It was nice to see such consideration for others being applied. They should really have a one-way traffic system to stop bottlenecks completely, but this might necessitate having to have fewer customers in the shop and a longer queue outside, what with all the pausing to take items off shelves, as Deirdre was doing. She was rearranging things in her trolley now as it was filling up near the brim. She didn't have a list, apparently, but seemed to remember what they always bought. So that was something, as it moved her along quicker by not having to look at a list, as some elderly bumblers appearing to be doing, wasting valuable moments trying to navigate around them at a safe distance in a high-risk environment. There was another set of queues at the tills, in fact. It extended back into the aisles, and they'd had to ask people to move over to let them get some groceries off the shelves as they navigated down the different aisles. He'd assisted Deirdre, who seemed to want to just stand there looking at those people, like she thought they might be able to read her mind. A simple "excuse me" said clearly, then pointing at the shelf, was enough to speed things up and get the task done so they could pay and get home. He was feeling oddly fatigued already, and the thought of the car still having to be washed when he got home made him feel more tired. They joined the end of the queue for one of the tills, standing behind the lines and leaned their heads out to the side as others were doing, to see how things were progressing up the front. Some people were very slow putting their items on the short conveyor belt, which fed items to the cashier, and some had bought far too many items, considering they were not allowed to speed things up by unloading their trolley onto the conveyor belt until it cleared the last customer's purchases, according to the signs above each checkout, and the loudspeaker message saying that you must please have patience and wait for customers to finish paying before approaching the checkout belt. This also reminded you to respect old people, he supposed for the same reason. They always moved slowly. One was letting her groceries take over the other end of the belt now, while she slowly packed her eggs and whatnots, one by one, into an ancient and scruffy-looking flowered canvas bag. They should ban those and make customers all use trolleys as they went through with you for the groceries to be put back in quickly so the checkout person could process another customer. Where was the worker on the till off to now? He'd left his checkout and all his customers in line and gone off with some item in his hand down the aisle. What the hell is he at, Deirdre? He appealed to his wife, staggered that anyone would abandon them like that. He's probably checking a price for her. They often forget to put a barcode on, or it gets crumpled up and they can't scan it. He stared at the display of sweets and other small treats for children to take his mind off the short disruption to the queue's movement, since they were at least in sight of the till now. He noticed they had masks and gloves beside the rows of chocolate bars, which surprised him since he thought they were only available in chemist shops. Deirdre was stocking up on these and reached for at least 5 packets of one and 2 of the other to put in their trolley. He peered at the label in its holder under them and noted the price per packet with a shock. He passed the rest of the time the cashier took to return from the aisles, figuring out how many of each item of protective wear there were to a pack, then calculating the price per item after first adding up the total for both. It was unbelievable how much they cost per mask or per pair of gloves. And then he set about trying to remember how many he used in an average day. As the one who totted put the receipts away in folders, he reminded himself that he should check where else she was wasting money instead of just looking at totals and totting them up at the end of the month so that they could split the bill for food equitably. These protective wear items were no doubt cheaper in the chemist, but he'd sort it out when they got home so as not to cause a scene in the shop and get her to buy them in the chemist shop next time they needed to stock up. They were spending resources now in order to stock up their resources in case supply chain issues struck suddenly. and he'd been pleased to see all the shelves were still full, and there were no problems at the moment. When the vaccines had been given to everyone, that would ensure nobody new got sick. Problem solved. After they'd packed their supplies in the car and she'd returned the trolley, they headed home. He reminded her to take any packaging off items and to thoroughly wash the things that didn't come packaged, like the avocados he'd seen her select individually, that he never could stand the taste of, but which she liked eating. She mustn't pass any infection to him, he thought, as he headed towards the bathroom sink to wash up thoroughly, turning his attention to the bathroom door handle with an apple-scented alcohol-based disinfectant spray he'd bought plenty of already. His gloves went into the small disposal bin under the sink. Everything in its place, he muttered, sighing, before going to get a bucket from the utility room with its sponge in it to fill up for washing his car. He'd do it first before having tea while waiting for his lunch to be ready. Saturday, and the weekend was already turning out to be more tiring than the week's work he'd put in already. Chapter 11. Sunday was worse. He was already feeling a bit grumpy over breakfast about the price of masks and gloves when he'd broached the subject of buying them at the chemist's instead of opting for convenience at the supermarket, and she told him they were even more expensive there. They could afford it, but it was exorbitant, the prices, and it was weeks more of paying out through the nose, as they say, before their vaccine doses would be likely to be administered by the doctor, at the rate it was taking them to get through the first cohort, according to the news on the radio he'd brought into the kitchenette to get the morning headlines. There was never much news on a Sunday, just a roundup, really, of what was happening with the virus and what effect it was having on everything. The toll, they called the death figures, and they summed up the deaths by adding some new statistic or other that they thought relevant every day, with any corrections being made if more figures were available from expert sources. He would have liked to put his statistics notebook beside his meal, but that wasn't mannerly, as he learned in his own youth. These days, you saw whole families eating in restaurant windows as you passed, with their phones out, glowing as they ate. Sometimes the children left their hats on too, which wouldn't have been allowed in his youth. He thought of his father and his stern presence at the table, always scanning the room for bad behaviour. Dead now, and his mother in another town. His sister lived with her, so he supposed she would be all right, as she was in the next cohort. Deirdre was saying something about someone's birthday. One of her teacher friends had turned out and been moaning the fact that they had nowhere to go with the restaurant and bars temporarily closed. Go to that hotel bar, that'll still be open. Problem solved. It isn't open either. We checked. Nowhere seems to be open. I don't know where people are supposed to meet anymore. They aren't. That's the point of all the new measures. He looked at her for signs of intelligence. She was looking out the window again towards the weed garden and apple trees she'd put in that hadn't yet given any fruit. Angela was almost crying on the phone, she said, after a moment still looking at nothing. I didn't know what to say to her. Oh, for God's sake, it's only a birthday. Tell her she'll have more. She'll survive a few weeks, then you can all get drunk together again. He hated seeing Deirdre getting drunk with her friends and hated the smell of wine in the living room when they'd gone. It reminded him of father and made him uncomfortable as a non-drinker. At least he didn't have that anymore, the noise and squealing laughter emanating from the living room nearly every week, the having to retreat to the other room to avoid them. Robert, I was going to go out for a walk. Would you like to come along? She was smiling now and looking at him for an answer. I don't think so, Dee, he said in a mannerly way. It looks like it might rain. He raised a chin towards the sky outside. Quite cloudy. I've things to do as well. He didn't like walks. They serve no purpose when you only ended up returning to your starting point, having gained nothing. You go, though, if you want. He pricked up an ear on hearing the news jingle play, as there was a mini news broadcast that came on at 10:30 that might have the statistics repeated, which he could jot down for his records he was compiling to refer to. Deirdre seemed to be saying something about going away anyway, since she was getting her coat from the hook beside the side door and fiddling about in pockets, looking for gloves or her keys or something, before exiting the kitchen. Don't forget to wear your mask, he reminded, just as he heard the door close. You never know who you'll meet out there, he continued, thinking out loud. Were people following the rules on weekends? Or were they being lax and sneaking into friends' houses, going for walks with friends, or going to beaches or public parks in groups, breaking the rules? They might be, unless authorities were watching them and taking action to stop it. There must be lots of people like Deirdre, restless sorts who couldn't sit still for a minute and wanted to head off here and there without thinking it through, or out of habit maybe. Many more people were at home than usual, so there might be hordes of them about at weekends. He stood and made his way to the living room and peered over the work table, leaning over to pull the laced curtain back a smidgen, so he could observe the street without seeming odd if anybody observed him observing them. Nobody really about. That was good. Rules were being obeyed then. He lingered briefly to admire the cleanliness of his car, comparing to the others in the recessed parking spaces assigned to several neighbours and his wife's car. His wife's not looking quite as clean as his own, since he wasn't due to wash it till next weekend. And then let the curtain drop back into position before returning to the kitchen to see if there was more coffee left in the pot, enjoying the quiet in the kitchen, which was ideal, since there was a Sunday news analysis show about to start with a roundup of the events of the week. Deirdre returned an hour later and crossed behind him into the living room. The distracting noise she was so fond of started up again, with classical music emanating from the living room. From her computer, which she usually left on, attached to some sort of a wireless speaker she had on a shelf in front of her novels and textbooks. There was a sound of things being moved about as well, he realised some time later, after the show had finished. Scraping noises, in fact, like furniture. Maybe she was finally giving the room a good going over and sterilising it after sterilising herself first after the walk. She probably stopped to talk to anyone she met out there. She was that type. He hoped if she did, they'd remember to keep their correct distance. He returned to the living room to investigate the noises. She appeared to be moving a huge easel about, and the craft table's contents were all piled up on the floor, with the table also having moved, squashed up against the row of shelves on the other wall of the small space. What the hell are you at? He asked, not appreciating the disruption one bit on one of his only days off, where he could wind down from a busy week in his own home. She turned and said, Robert, I've decided to take up painting again while I have the time to take a good run at it. The walk was very inspiring and the park just beautiful, what with all the fluffy clouds scudding over and then the sun coming out, changing all the colour in the leaves and sparkling on the little duck pond. The ducks were having a wonderful time, all splashing about too. He stared at her, thinking she was talking fluff, and the ducks probably had more sense than her. She continued, You know, if I was an impressionist, I'd probably have a light easel I'd strap to my back with my paints and head out with a straw hat on to stand in the park and paint for the day. But that sounds a bit awkward, so I thought I might take photographs and set up my old easel and paint from these. She held out her phone, nearly tripped over the piled up books and craft whatnots on the floor, and wiped her finger across the screen, shoved her phone at him, presumably to show him photos of the ducks or something. Yes, ducks and trees. She should add fairies to the paintings, as the painting he'd seen by the guy that was a lunatic were full of, as she was with the fairies as well. As they say, not the full shilling. She'd look like that Van Gogh fella, who was mad as well, and wore straw hats too, unless he let her stay in the house painting. Well, where's the other mess going to go if you're putting out your paints and that big palette on the table and all those brushes on the bookshelves? Deirdre, you're very disorganised with all these different hobbies. Why don't you just stick to one thing? He was appealing to reason, if she had any. It was a small enough space already without her trying to make it claustrophobic. I'm not sure yet. I've had to put the extra groceries on the shelves in the utility room over the washing machine, or I would have had room there. I'll find space for them, though, after I get the painting things set up. Don't worry, Rob. She was looking at the pile, hands on hips, as if confident she'd find a solution. He wasn't so sure, but left the scene of the crime, as it were, to retreat to the spare room where order reigned, to start in on the May household accounts, leaving her in the midst of music and mess.